Hi, Nathan Ritter from cardiogauge.com. I'm a cardiologist in New York. This video is about chloroquine and hydroxychloroquine for coronavirus. Does it work? Chloroquine was discovered as an anti-malarial medication in 1934. It's similar to quinine, the original malaria medication. Hydroxychloroquine is a modification of chloroquine with fewer side effects, previously known as Plaquenil, super commonly used in lupus and rheumatoid arthritis, and is currently generic. Both chloroquine and hydroxychloroquine have been studied in the past in treating viral infection, and currently, desperate medical staff who are treating coronavirus patients have been trying anything that could possibly work. Due to an indication of early success, there are now at least 23 studies going on. The widespread excitement comes from test tube work and very limited study in humans. This study, published in China in mid-February of this year, showed clearance of the virus in 5 out of 10 people on chloroquine versus clearance of virus in 3 out of 15 people on lopinavir and ritonavir. And this is the study that's caused all the excitement the past few days. It was led by Dr. Gautret from France. They gave hydroxychloroquine 200 milligrams 3 times a day to 26 patients. 16 patients did not receive the medication. 6 of the patients who were receiving the medication were excluded from the analysis. Of the remaining 20 patients who took the medication, 20 out of 20 cleared the virus from their bodies at day 6, compared to only 2 out of 16 people who did not take the hydroxychloroquine. Some of the patients treated with hydroxychloroquine also received azithromycin, another medication which has been shown to be effective against virus in the past. A study based on test tube work, hydroxychloroquine was shown to be more effective than chloroquine at reducing viral activity. So how does hydroxychloroquine work? It inhibits endosome acidification and prevents release of viral RNA into the cell, and it can also decrease the damage caused by a hyperactive immune system. This is by no means a done deal. The studies were small. Also, there was a study of chloroquine in another RNA virus, the chikungunya virus, where it was proven to be ineffective. On to another quick topic, quinine for coronavirus. Is this fake or unfake news? It's natural that people would wonder about quinine as a treatment for coronavirus because it's closely related to hydroxychloroquine, and it's also available in small quantities without a prescription. Quinine is present in tonic water, like 80 milligrams per liter, something like that, and it's also present in cinchona bark, where it was originally found. Cinchona bark has approximately 100 milligrams per gram. There are supplements with quinine in them as well, but the concentrations are unknown. The typical dose of quinine used to treat malaria would be something like 650 milligrams 3 times a day, and that would amount to 8 liters of tonic water 3 times a day. I suppose you could boil it and distill it and try to get the quinine that way, but it's hard to imagine that you'd be able to know exactly how much quinine you were getting if you did that. More bad news here is that quinine can be dangerous, even lethal. It can lead to heart rhythm problems. It has a narrow therapeutic index, meaning that there isn't a big difference between the effective dose and a toxic dose. I guess it's plausible that someone could come up with enough quinine to try to treat themselves for coronavirus, but I wouldn't recommend it. I don't consider quinine a legitimate treatment for coronavirus. And lastly, a brief update on ACE inhibitors and ARBs in coronavirus. There's been no change in the ACC recommendation from last week's video to continue ACE inhibitors or ARBs. My one patient with COVID-19 was on losartan, and she had a really good recovery. Also, I'm off quarantine and back to work. I never developed any symptoms of coronavirus infection. I wonder if I'm an asymptomatic carrier, but we don't have any tests to use for people who don't have symptoms, so I'm out of luck there. Thanks for watching. Please share the video if you found it helpful. I'll see you next week.